Welcome to our presentation on exercise with oxygen therapy or EWOT and its benefits for osteoporosis patients. Today, we'll explore how this promising approach can support bone health by enhancing oxygen delivery to tissues. We'll cover the top 10 benefits of EWOT specifically for individuals with osteoporosis, grounded in scientific principles and available research. Let's understand the key concepts behind this therapy. Exercise with oxygen therapy combines physical activity with supplemental oxygen. Developed by Dr. Manfred von Ardenne, EWOT typically involves light to moderate exercise while breathing highly concentrated oxygen, usually through a mask or in a chamber. Sessions generally last 15 to 30 minutes and are performed regularly for cumulative benefits. Osteoporosis is a bone disease characterized by decreased bone density and increased fracture risk. It affects over 200 million people worldwide and is especially common in aging populations. Key risk factors include aging, hormonal changes, particularly in postmenopausal women, and reduced physical activity. EWOT may help counteract mechanisms of bone loss by improving oxygen delivery to bone tissue. Here are the 10 key benefits of exercise with oxygen therapy for osteoporosis patients that we'll explore in detail. First, EWOT stimulates bone formation by enhancing oxygen delivery to osteoblasts. Second, it improves muscle strength and coordination, reducing fall risk. Third, EWOT enhances circulation to bone tissue, delivering essential nutrients. Fourth, it reduces inflammation, which can contribute to bone loss. Fifth, it boosts energy levels, enabling patients to sustain important exercise routines. Sixth, EWOT supports hormonal balance that affects bone health. Seventh, it improves posture and alignment to reduce fracture risk. Eighth, it enhances immune function for better recovery and overall health. Ninth, EWOT promotes pain reduction through multiple mechanisms. And 10th, it improves overall quality of life by enhancing independence and well-being. These benefits are supported by mechanistic plausibility and related research in exercise science and oxygen therapy. Let's examine our first two key benefits in greater detail. Benefit 1. EWOT stimulates bone formation. Weight-bearing and resistance exercises are known to stimulate osteoblast activity, the cells responsible for bone formation. EWOT enhances these exercises by increasing oxygen delivery to bone cells, which rely on oxygen for metabolic processes. This enhanced oxygenation supports cellular energy production, potentially amplifying the bone-building effects of exercise. Research by Frost in 2004 highlights the role of mechanical loading in bone formation, and von Ardenne's work suggests EWOT's oxygen supplementation may enhance these effects by optimizing cellular metabolism. Benefit 2. EWOT improves muscle strength and coordination. Osteoporosis patients are at higher risk of falls due to muscle weakness and poor coordination, which can lead to fractures. EWOT combines exercise with oxygen therapy, improving aerobic capacity and muscle endurance. The increased oxygen availability enhances muscle performance and recovery, allowing patients to engage in strength training more effectively. Stronger muscles and better coordination improve balance and stability, reducing fall risk. Studies by Liu and Latham in 2009 demonstrate improved muscle strength with resistance training, and EWOT's oxygen boost may make exercise more accessible for those with cardiovascular or respiratory limitations. Now, let's explore benefits 3 and 4 of EWOT for osteoporosis patients. Benefit 3. EWOT enhances circulation to bone tissue. Adequate blood flow is critical for delivering nutrients like calcium and vitamin D to bone tissue, supporting bone remodeling. Osteoporosis patients often have compromised microcirculation due to aging or comorbidities. EWOT promotes vasodilation and improves capillary perfusion, as demonstrated by Dr. Manfred von Ardenne's oxygen multi-step therapy research. This enhanced circulation ensures that bone cells receive the oxygen and nutrients needed for repair and maintenance, potentially improving bone health. As Bonjour noted in 2011, nutrient delivery is critical for bone formation and maintenance. Benefit 4. EWOT reduces inflammation. Chronic low-grade inflammation contributes to bone resorption by activating osteoclasts, the cells that break down bone. Hypoxia, or low oxygen levels, can exacerbate inflammation, worsening bone loss and osteoporosis. EWOT counteracts this by increasing oxygen levels, reducing inflammation in tissues. Von Arden's work suggests that EWOT reduces endothelial swelling in microvessels, decreasing systemic inflammation. Mundy's research from 2007 confirms that inflammation drives bone loss, suggesting that EWOT's anti-inflammatory effect could slow bone resorption and support bone health in osteoporosis patients. Let's examine benefits 5 and 6 of EWOT for osteoporosis patients. Benefit 5. EWOT boosts energy and reduces fatigue. Osteoporosis patients often experience fatigue, particularly those with comorbidities or reduced physical capacity, which can limit their ability to exercise. EWOT enhances oxygen delivery to muscles and tissues, reducing lactic acid buildup and accelerating recovery from physical exertion. This allows patients to sustain exercise routines that are critical for bone and muscle health. Research on EWOT in various populations, including athletes and long COVID patients, shows reduced fatigue and improved endurance. Nikander's 2010 research suggests that regular exercise improves energy levels in osteoporosis patients, and EWOT's oxygen supplementation may enhance these effects. Benefit 6. EWOT supports hormonal balance. Hormonal imbalances, particularly low estrogen in postmenopausal women, accelerate bone loss in osteoporosis. Exercise is known to modulate hormones like growth hormone and insulin-like growth factor 1, IGF-1, which support bone formation. EWOT may enhance these hormonal responses by improving oxygen delivery, optimizing cellular metabolism during exercise. Veldhuis and colleagues demonstrated in 2005 that exercise-induced hormonal changes are well documented, and EWOT's oxygen supplementation may amplify these effects, creating a more favorable hormonal environment for bone maintenance. Now we'll discuss benefits 7 and 8 of EWOT for osteoporosis patients. Benefit 7. EWOT improves posture and alignment. Osteoporosis can lead to kyphosis, or hunched posture, and spinal deformities due to vertebral fractures. EWOT, when paired with exercises targeting core and back muscles, can strengthen the musculoskeletal system, improving posture and spinal alignment. Enhanced oxygenation supports muscle endurance, allowing patients to perform posture-correcting exercises more effectively. Research by Bansal and colleagues from 2015 shows that exercise interventions for osteoporosis improve posture with strength training, and EWOT may enhance these benefits by reducing exercise-related fatigue. Better posture not only improves appearance, but also distributes forces more evenly across the vertebrae, potentially reducing fracture risk. Benefit 8. EWOT enhances immune function. A strong immune system is essential for overall health in osteoporosis patients, who may be vulnerable to infections or delayed healing after fractures. EWOT improves oxygenation, supporting immune cell function, as immune cells rely on oxygen for optimal activity. Research by Sitkovsky and Lukashev in 2005 indicates that oxygen levels influence immune responses, and EWOT's high oxygen environment may bolster immunity. For osteoporosis patients, this could mean better recovery from injuries and improved general health, indirectly supporting bone maintenance. This becomes especially important after fractures, when proper immune function facilitates healing. Let's conclude our exploration of EWOT benefits with the final 2 advantages for osteoporosis patients. Benefit 9. EWOT promotes pain reduction. Osteoporosis patients often experience chronic pain due to fractures, muscle weakness, or poor posture. EWOT's combination of exercise and oxygen therapy can alleviate pain through multiple mechanisms. First, it improves circulation, reducing ischemic pain in tissues. Second, it decreases inflammatory mediators that trigger pain signals. Third, physical activity during EWOT stimulates the release of endorphins, the body's natural pain-relieving hormones. Enhanced oxygenation also supports tissue repair, potentially reducing pain from micro-injuries. Studies by Ungeen and Erden in 2013 show that exercise reduces pain in osteoporosis patients, and EWOT's oxygen component may enhance these effects by improving tissue oxygenation. making it a valuable approach for pain management. Benefit 10. EWOT improves overall quality of life. Osteoporosis can significantly impact quality of life due to pain, reduced mobility, and fear of fractures. EWOT improves physical fitness, reduces fatigue, and enhances mood through endorphin release and better oxygenation. These benefits enable patients to engage in daily activities with greater confidence and independence. Research by Gian Gregorio and colleagues in 2014 demonstrates that exercise programs for osteoporosis patients improve quality of life, and EWOT's ability to make exercise more tolerable and effective may amplify these outcomes. This holistic improvement in well-being may be the most meaningful benefit for many patients, allowing them to maintain an active, fulfilling lifestyle despite their diagnosis. As we conclude our exploration of exercise with oxygen therapy for osteoporosis, let's summarize the key benefits and important considerations. We've examined 10 significant benefits of EWOT for osteoporosis patients, from stimulating bone formation and improving muscle strength to enhancing immune function and quality of life. The radar chart on screen visualizes the potential impact of each benefit, with bone formation, quality of life improvements, and circulation enhancement showing particularly strong potential. However, several important considerations should be kept in mind. First, research limitations exist. Large-scale clinical trials, specifically examining EWOT and osteoporosis, are limited. Much of our evidence is extrapolated from studies on exercise, oxygen therapy, and von Arden's work in other contexts. Medical supervision is essential before starting EWOT, particularly for those with cardiovascular or respiratory conditions. The exercise protocols should be adapted to each individual based on their age, fitness level, and osteoporosis severity. Additionally, EWOT should supplement, not replace, traditional osteoporosis treatments like medication, calcium, and vitamin D supplementation. Despite these limitations, EWOT offers promising benefits for osteoporosis patients when properly implemented as part of a comprehensive treatment approach. The combination of exercise with enhanced oxygen delivery provides multiple pathways to improve bone health, physical function, and overall well-being. We've reached the references slide where we acknowledge the key research supporting our presentation on EWOT for osteoporosis. Throughout this presentation, we've referenced several important works. The foundation of oxygen therapy principles comes from von Arden's 1990 work on oxygen multi-step therapy. Frost's 2004 research on the Utah paradigm of skeletal physiology provides insights into bone formation mechanisms. Liu and Latham's 2009 Cochrane review demonstrates the value of progressive resistance training for improving physical function in older adults. Additional research by Bonjour on nutritional aspects of bone health, Mundy on inflammation's role in osteoporosis, Nikander on targeted exercise, Veldhuis on hormonal control, Bensal on posture improvement, Sitkovsky and Lukashev on oxygen's influence on immune function, Angjin and Erden on pain reduction, and Gian Gregorio on quality of life all contribute to our understanding of how EWOT may benefit osteoporosis patients. It's important to note that while the benefits of EWOT for osteoporosis have mechanistic plausibility, direct large-scale clinical trials are limited. This presentation synthesizes evidence from exercise science, oxygen therapy research, and bone physiology. We strongly recommend that patients consult healthcare professionals before beginning any new therapeutic approach. Thank you for your attention to this presentation on exercise with oxygen therapy for osteoporosis. We hope this information helps guide clinical decisions and patient education regarding this promising